Hi, my name is Pat Davis, and I am known as your health plan man. And I just wanted to share a few minutes with you about some of the things that are happening with health insurance in America. One of the main things is there's been some big law changes of late, and most people aren't getting to take advantage of those changes, which is really sad. So you have a pacemaker that someone has implanted, and it cost $100,000. That's what gets billed to the insurance company anyway. But the actual cost is only about $9,500. Now that should infuriate you. I mean, it really does me. The only reason people keep standard insurance like they've had for years and years, whether that's an ACA, Obamacare plan, or a plan through their employer, or whatever that might be, they all come down to one thing, and that's there's been a brainwashing and a conditioning that there's really only one kind of insurance. You pay your premiums every single month. You have a claim, you go to the hospital, you go to the doctor, whatever it might be, and then you take your money out of your pocket again. Well, think of it this way. When you have a life insurance claim, do you pay the life insurance company to be able to get your money? Well, of course not. Well, I like to use plans that work on the same concept. I pay my premiums every single month like everybody else does. What a novel idea. How about the insurance company puts its money up first? And I can show you how to do that. If you have any of what we call the big box insurance company, you take any insurance company, if it's got a big name, then you can't do what I'm talking about. And even if you could go to a hospital and say, you know what, I see on your pricing that it costs this much for this service, it won't matter. You can't take advantage of that unless you have a company that works with what's called transparent pricing. And just recently, our president signed an executive order that hospitals have to show their true pricing, we call it transparent pricing, online. As an independent agent, I can write for any company I want. I've written for the big name companies, but I won't anymore because I've seen how effective it can be when you can take control of your own health care, your own health insurance. So if you go to the doctor, you pay less money. If you go to the hospital, you pay less money. And I constantly am cutting people's premiums in half. That's very, very real. The high deductibles, the high out-of-pocket, that doesn't have to be. And like I said, provider choice, wow. Go to any doctor anywhere in the country. Here's another thing to think about. You know that most insurance agents don't even own what they sell? I do. In fact, when I recommend a plan, I recommend a mirror of what my wife Marcia and I have. So I'd like to talk with you a few more minutes if we could sometime. I appreciate you giving me an opportunity to share, and I look forward to sharing with you a little bit more.